Hi everyone, this is Shalu Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. I am back with another NMC adult and NMC video for NMC OSCE exam video for you. So if you like my videos, please press the like button now and subscribe to my channel. And I'm really hoping these videos are helping you to revise and prepare for your exam so you can pass it first time. Right, okay, so today's video, you've been asking me for a long time, and recently there has been quite few fails. There has been a lot of fails on this station, which is the inhaled medication, because there are two techniques to give inhaled medication using inhalers using a spacer, and people are getting quite confused with it. So I am going to show you today what are the common fails in this station and how to avoid those common fails. I've already done a video on inhaled medication before, but there has been slight changes, the marking criteria, and also I just thought now I will show you the technique this time how to do it so you don't get it wrong. Right, okay, so I am in today's video, I'm going to talk you through what are the common fails, and then also a clip in there to show you how to give inhaler. So I will be giving inhaler to this mannequin in this clip, so I'm going to show you the video clip as well. Okay, so that's what we're going to do today. So this is your 12-minute station. It's normally set in community scenario, so you get a very simple prescription for it, and normally your patient is come to GP surgery. GP has asked you to give this inhaler to this patient using a spacer. That's what you need to do in 12 minutes, following all the principles of drug administration, because we're giving a drug. So the first common fail is, after you do your scene safety, close the curtain, clean your hand, and you need to check the ID. That's the first thing. So you need to do full ID check and allergy check against your prescription chart, because your patient is not wearing a name band if they are in community. So say if this was set up in community, you will be checking the name, date of birth and address, and then allergies as well, asking for allergies, asking for reaction, and making sure it's exactly the same, it matches your documentation, which is your prescription chart. That is a very, very common fail, because we concentrate on the skill but we forget to make sure that one of the main principles of giving drug is the correct patient. So we need to check the ID and allergy. So that's number one. Number two is, always tell your patient, always take valid consent. Inform your patient what you're going to do and take a valid consent. Don't move on with your station until your mannequin voice, obviously examiner voice will be the mannequin voice, will say yes, and then carry on. So that's the other common fail people are failing on. Number three is that you need to clearly tell your patient before you start setting up your equipment and everything, which technique you are going to be using, because your marking criteria now is this bit of confusion. Your marking criteria is talking about two techniques. One is holding breath and one is multiple breath technique, which we call tidal breathing. You can use any of it, okay? Examiner doesn't mind which one you use as long as you use it correctly, but tidal breathing method is used a lot more frequently, so I'm going to show you that one today. So you need to tell your patient clearly which method you're using. So if I'm using tidal breathing method, multiple breath technique, I will just tell my patient, I will not be asking you to hold the breath today. I will be showing you how to take inhaler using spacer with tidal breathing, which is a multiple breath technique. We will use that today to give you your inhaler. So you have to be very, very clear. So that's very common mistake. Number four is checking the validity of your prescription. So making sure you read everything on the prescription chart, starting from patient name to ID details, the drug name, the prescriber name, the dose, the route, the due time, the prescriber signature, and everything. So you need to make sure you read everything on the prescription. As you can see on the screen, I put a prescription, very simple prescription. That's what you get in exam. That's what they have released on the test center website. So you need to make sure that you can read it very clearly and declare it that it's legible prescription, is clear legible prescription, and you are happy to give this inhaler. So again, so now we coming to tip number 5 here. Before you start giving the drug, you need to make sure you check the name of the drug. They always tell you your inhaler is clean. They always tell you your spacer is clean. So you don't need to clean anything. You need to clean your hands, and then you need to pick up the drug. Before you give it, attach it to your spacer. Make sure you check do all the drug checks. So you need to check the name of the drug, you need to check the expiry, you need to check the dose. You also need to check that your drug is the same drug as your prescribed drug. So you need to match it to your prescription very, very clearly, showing to your examiner, this is the drug I am giving examiner, and I am checking this again my prescription. Yes, this is salbutamol. Yes, in my prescription this is salbutamol, is whatever 100 microgram. Yes, it's the same as in my prescription, and I will be giving 1 puff or 2 puffs as prescribed, and I can check that this is the same drug as my prescribed drug. So that's really, really, really important, and I can't tell you how many people fail on that. Not checking your drug against your prescription. Now, moving on to number 6 now, which is obviously our technique now. So that's the bit I'm going to show you in the video clip, how to use the correct tidal breathing method to give that. So I'm going to start the video from there. So where I have done all the checks, I've done my drug check, I've done the validity prescription, I've done the ID check, I've done all that. Now I'm ready to give this using tidal breathing method. So I'm going to show you that clip there, okay? And then in the end, the last one will be documenting, making sure you do not forget to document on the prescription chart that you have given drugs. So we're gonna start it from the technique and finish it with the documentation, and that would be the end of this station. So let's watch that clip now. I'm gonna clean my hands again before we start giving it to you. Okay, Lawrence, like I said, I will not be asking you to hold the breath. We're going to use a multiple breath technique. So I'm going to do it. So I'm just going to take the cap of the inhaler here. Going to put that into. I'm going to take the mouthpiece off for you to take in your mouth later on. So I'm just going to shake the inhaler for 2 to 5 seconds. So 1, 2, 3, 4, 5. Going to put it back in here. Okay, so we attach your inhaler to your spacer device. You're sitting upright, that's good. And now just exhale completely, okay, and then grab the mouthpiece into your mouth, make a seal, and start breathing deeply in and out. Okay, you started breathing deeply in and out. Now tip your head back. Yeah, you tipped your head back. I'm just going to give you your first dose. Right, keep breathing in and out 5 times. So 1, 2, 3, 4, 5. Okay, so we're going to take this out. You can exhale now, and we will wait 30 seconds to 1 minute to give you your second puff, because you're written for 2 puffs here. Okay, so we're going to do the same steps again. So we're gonna shake it 2 to 5 seconds, 5, and then we're going to attach it again. You can exhale and then grab the mouthpiece into your mouth, make a seal with your lips, and okay, now start breathing deeply in and out. Okay, you started breathing deeply in and out. Just tip your head back again, and I'm going to press for your second puff. Okay, you tipped your head back, so second puff now. So keep breathing in and out 5 times. 1, 2, 3, 4, 5. So yeah, okay, so that's done. Right, we're going to take it out. You can exhale now. I'm going to put this into here for now. Okay, we are going to I'm going to just clean it for you to take home. Okay, so this is for you to take home with your, so you can use this to take your inhaler at home. So just going to put some gloves on. Okay, we're going to now wipe this using a cleaner wipe, which they have already told me is ready and clean and ready to use these wipes. So I'm just going to clean it from the cleanest to the dirtiest. So top towards the mouthpiece in a circular motion. Okay, going to clean this as well. Going to put that back on. We'll just leave it here for drying for you to take home. And I'm just going to get rid of this into the clinical waste, get rid of my gloves in the clinical waste. clean my hands and I'm going to document for the given drug. Okay, so what we're going to do here is signature. So I'm just going to write my signature, and I'm going to write the date. Today's date, time is 12:30, which is the due time on the prescription, so I've given that. So inhaler examiner, I will store the inhaler as per policy, or if it's patient, if it's the patient own inhaler, I will give it to the patient. So that's and you feeling okay, Lawrence?
Yes.
Okay, so I will tell your GP that you had the dose as prescribed by your GP, and I'm just going to do my final hand hygiene. So okay everyone, I hope you enjoyed the clip. You have seen how to give a inhaler using the spacer device, using tidal breathing method, which is a multiple breath technique. And like I said, my last top tip was, do not forget to document for what you have given on your drug chart. Okay, and make sure your patient is comfortable at the end. And these are the common fails, and there has been quite a lot of fails recently in the test center for this station, and it's a very popular station. So make sure you are doing it correctly and keep these fails in mind so you do not end up doing the same mistake. So okay, so that's the end of the video for today. So hopefully you liked the video. So if you did, please press the like button and subscribe to my channel, and I will soon be back with another video for you. And if you want to know more about our training, please go to our website, which is www.oscenurstraining.com. And if you want to email us, it's oscenurstraining@outlook.com, and you can email us and get more information if you wish to. We offer both face-to-face and online training. So I will soon be back with another video. Bye for now.